Here to talk to you about minus nystagmus. Now, minus nystagmus is known as one of the first occupational illness that is ever diagnosed. So, what is a nystagmus? It is a condition where the eye is moved rapidly and uncontrollably. Now, generally, they only move in a certain plane, and the movement is always oscillatory. Now, it could be a horizontal nystagmus where the eye moves horizontally in the horizontal plane, or it can be a vertical nystagmus where the eye moves up and down, or a rotated nystagmus where the eye moves clockwise or counterclockwise. Okay. Now, as I've already mentioned, it was the first occupational illness that was diagnosed and where compensation was actually given. The usual onset is between 40 to 60 years of age. This is caused by a prolonged low light exposure, which causes the loss of sensitivity of the light receptors seen in the retina. And this brings about visual pathway changes, and this leads to nystagmus. Okay, as you can see here, you see looking at the eye movements, the nystagmus that is elicited at extreme movements. So basically, when a coal miner works in a dark shaft where the light is not available, he by the age of 40-50, he tends to have nystagmus. Now you can see how the horizontal nystagmus looks like. You can see what the vertical nystagmus looks like. Okay. You need to understand that generally in coal miners nystagmus, the attack is usually horizontal or rotating. Okay. The patient will also complain of dizziness, headache, and tremors. He will also have photophobia and the loss of ability to see in dim light or night vision. He will also have psychoneurotic symptoms, that is intense anxiety, depression, mood swings, etc. Now, the general diagnosis is by complete neurological examination and by a CT scan. Okay, so the assessment has to be with history, as I've already mentioned. Okay, the longer the exposure, worse the prognosis. So, unfortunately, we have not been able to find a minimum duration where which this condition onsets, and there is no maximum latent period either. So technically, a person who starts working in the mine for 2 years or a person working in 10 years have equal risk of getting this illness. Now, if it's diagnosed early, the prognosis is good. But if the occupational exposure is not avoided, this can lead to a permanent disability.